Good evening, everyone. Thank you so much for joining us for this month's Prevention and Wellness series topic. For this month, we are discussing managing fear and anxiety. My name is Michelle Allen. I am a social worker by training, and I am also a proud board member with the Cancer Survivors Park Alliance. And here today, we will have two guest speakers in discussion with this topic. And before we get started, I just encourage everyone to take a moment and really capture the topic of this discussion. And when we talk about fear and anxiety, as you can imagine, whether you're a patient, a caregiver, a loved one, there's a range of emotions that is connected to a cancer diagnosis. And so hopefully today's discussion not only will be informative, but also to allow you to feel that it is normalized to have a range of emotions, to experience fear as well as anxiety. And so I hope that you all enjoy this presentation and we will get right into it. So I would love to introduce our providers who will be speaking with us tonight. I have the pleasure of working very closely to these two young ladies. And the first provider who we will be speaking with for today's discussion is Stacy Alexander. Stacy is a consult liaison for Bon Secours Mercy Health. She services our patients at St. Francis Downtown, East Side, and as well as our emergency room in Simpsonville. She has a master's of science in nursing with also a specialty in psychiatric mental health, nurse practitioner, as well as a master's in nursing education. She has 16 years of experience in the emergency room department, as well as with case management. One of our other providers as well is Laura Alonzo Price, who also is a consult liaison for Bon Secours Mercy Health. She services our patients as well at St. Francis Downtown, East Side, as well as Simpsonville. She has a master's of science in nursing with psychiatric mental health nurse practitioner. She also has credentialing in licensed independent social work with clinical practice. And she also has an extensive amount of experience, 11 years in ICU, PACU, and case management. So before we get into some specific questions, I would love for our providers to not only again introduce themselves, but anything that they would like to share before we get into tonight's topic.
Hey, again, Stacy Alexander, one of the psychiatric nurse practitioners here with Bon Secours. Just like Michelle stated, I've actually been with Bon Secours since 2004. Started out originally as a ER nurse for about 10 years, then moved into ER case management. And that's where I really started my love for mental health and helping others with mental health. So that led to returning to school to get my nurse practitioner and continued with St. Francis.
Thank you.
Hi, everyone. My name is Laura. I am a consult liaison, psych nurse practitioner for St. Francis. I graduated 2 years ago and had been with the ministry for 5 years before that. Started my career as a social worker, became licensed to do therapy, and then transitioned into a psych NP role several years later. We both have a strong passion for mental health and primarily see most of our patients in the emergency room, but also get to work with patients on our oncology floor. And yeah, I hope this presentation is helpful for the patient population.
And again, thank you so much, Stacy and Laura, for joining us tonight. All that you do is appreciated, and we cannot wait for you to share the wealth of knowledge that you all have. So we have some specific questions. And again, for tonight's topic, we're talking about managing fear and anxiety. And one of the first questions I wanted to start with is how common is it to experience anxiety and fear after having a cancer diagnosis?
So we know that a lot of mental health issues can come up related to a cancer diagnosis. So when we think of distress, that's kind of like the overarching theme. And it's a continuum. It ranges anything from normal feelings of feeling vulnerable, sad, fears about becoming disabled, to things such as depression, anxiety, panic, feeling socially isolated, having spiritual crisis. On top of that, the sort of the other things that we don't talk about that also increase anxiety, like perhaps the added financial stressors, difficulties with housing, not having social support, troubled relationships, or prior to maybe the diagnosis, already struggling with just day-to-day living. When we think about anxiety specifically, we know that that tends to present itself, pretty high, 34% in the cancer population, and that's very high compared to the general population. And anxiety is a normal reaction that happens with a cancer diagnosis, but I think one of the important things that I think we don't always consider is that even when it's normal reaction, those feelings can become excessive and impairing. And so we don't want to disregard those because there are a lot of things and a lot of tools that we can provide and help with to manage that. Depression, we see a little bit less. So that's at 16%. And then dysthymia, which is sort of kind of a lower version of depression, if you will, at 22%. Another symptom that I put in there is fatigue. We don't generally kind of identify that in the psychiatric diagnosis realm, but we know that it also plays a huge impact into how we're able to function day to day. And we also know that during active treatment, fatigue is a very big issue amongst cancer patients and can make it really difficult to get involved in treatment.
And Laura, I'm glad you touched on a lot of different areas as far as how, these range of emotions take place at the initial time of diagnosis, throughout the course of treatment, as well as, like you stated, in connection to socialization, as far as socializing with peers. So I think it's very interesting when the overall picture, like you said, as far as distress, as well as depression being a little bit lower, but also fatigue being something that sometimes goes unnoticed, whether that is just mental exhaustion as well as physical exhaustion as well. So. Our next question is, what are the typical signs that anxiety and fear is becoming a mental health concern rather than a natural reaction?
Yeah, so the thing about anxiety is that, it can come and go, and it can happen for a wide variety of reasons. So, we know that in situations, so maybe the initial diagnosis period, we talk a lot about that waiting period, the fear of the unknown, that can kind of really ramp up anxiety. Then there's the anxiety that comes once you have the diagnosis, what treatment is like. There are, a small group of people that also have lots of anxiety when it comes to nausea and vomiting. And that's obviously one of the biggest known side effects of chemo treatment. So, that anticipatory anxiety that we call like knowing what things are going to be like. And because they're super stressful, just already kind of building up anxiety before leading up to that. Then there's, what we call primary anxiety. So people may be diagnosed with that obviously prior to, have already been struggling with that. And we know that the people that have mental health diagnosis prior to getting diagnosed are at a higher risk for things getting worse. And so lots of different things to look at. But as far as symptoms go, we have a couple listed. So restlessness, having a difficulty concentrating, feelings of being wound up or on edge, irritability, not being able to relax, and difficulty controlling worry. some of these things you may not recognize in yourself. So that's why it's super important that you're maybe involving family or loved ones or anybody that is able to kind of pick up on those things, because it can be difficult to acknowledge that we are struggling. Physical symptoms that people might be more willing to share are, having difficulty sleep, staying up thinking, all the different things about, how am I going to get treatment? When am I going to get better? Is this going to go away? Fatigue, like we talked about, headaches, muscle tension, and loss of appetite. So although we may not always see the psychological symptoms or be able to recognize those, sometimes the physical symptoms are usually much easier for people to identify or at least relate to and feel more comfortable sharing those.
And I thought it was a good point that you mentioned far as anticipatory anxiety. And in my experience with working with patients, I would often hear even just pulling up to a cancer center or having to see certain things that puts you in connection to having a cancer diagnosis. So I think even just recognizing that the normalcy of that occurring and how that impacts you not only psychologically but physically very much is important to know and to be aware of, especially whether you're supporting a loved one with cancer or even as a direct patient.
Yeah, no, absolutely. And I think too, outside of treatment, even things like you said, getting to the building, right? Like going to see your doctor, that may, trigger that, oh, that's when I got diagnosed, walking into this building.
Mhm.
Other kind of small things that we don't always talk about, but like MRI machines, there's a huge, claustrophobia. There's so many things involved in treatment that can really trigger somebody.
Absolutely.
Kind of wanting to be aware of that. And so there are treatment options available. And luckily, there's all different kinds of ways that we can approach this. And best case scenario, you're able to tap into each of those services. Medication is usually kind of at the forefront of things because we know that things like SSRIs, and benzodiazepines. So we, examples of those are like antidepressants, things like Lexapro, Zoloft, Prozac, and then benzos like Xanax, Ativan. Those things can be helpful. We talk about those as tools. Obviously, those are things that are certainly not going to take away the current situation at hand, but it can definitely help alleviate day-to-day feelings of anxiety, kind of help what we call like the chronic state of feeling anxious and alarmed. And then the benzos are really helpful for things like procedures or events where that anxiety is going to be heightened. As far as therapy goes, we know that cognitive behavioral therapy is usually the therapy of choice. Gives people an opportunity to learn different skills, and different methods of relaxation and kind of almost like retraining your brain. Like, how can I walk into this building without ramping up? How can I get through the next, couple weeks of chemo, be able to get out my door?
Mhm.
And then, the support groups I think are a really good opportunity to connect with others. In one of the later slides, we talk about some of the individual impacts of different cancer diagnosis types. And so I think, being able to connect with others, not just the patients themselves, but also family members. I know there's a lot of opportunities for that in the community. And, just giving people an opportunity to socialize as well, because I know that social isolation tends to be a big issue when we're sick.
And Stacy and Laura, this question is for both of you. What is your experience working specifically with oncology patients who may be resistant to trying medications or scared of what side effects may take place? How do you all approach that, or what has your experience been when working specifically with oncology patients in reference to that?
Well, I think not, specific with just oncology patients across the board. We always want to, validate fears, especially with side effects. And when you're talking with specifically oncology patients, already they're being suddenly overwhelmed with, tons of medications, new medications with possible side effects across the board. And, then they're thinking, yet, am I going to have to be dealing with yet another medication, more side effects. So I think the biggest thing we can do is listen to those fears, validate those fears and concerns, and then really try to just work with them and say, okay, you know, this are the possible side effects. These are the most common. These are ones that typically once our body gets used to them, some of that gets goes away. And there are ways that we can help with some of those side effects if needed while your body's getting used to them. So I think the biggest thing is just listening to those fears and validating those fears and talking with them. And at the end of the day, if it's something that they're not necessarily open to, adding on another medication, again, just as Laura has stated, there are other ways to try to help manage it. If they would prefer to go more of just a therapy route or support group route, or ways to cope and manage. So I would say that was some of the biggest key points.
And I guess to add on to that, there's no one size fits all. There are people that, would say, I don't want to be around a bunch of other people. And so, medication or individual therapy may be, what's the best fit for them. Some people want to try everything, So really meeting people where they're at, and figuring out, what their best plan is. And for some people that may mean medication today, therapy tomorrow, um, trialing different things. It may take time to figure out what the best balance for that person is.
And I think it's also a key point to always make people aware that medications are not permanent. As far as mental health medications, they don't always have to be a lifelong medication. Could be just a medication to help you manage at this point in time, and what it can do for you to help now. But it does not mean that down the road that you will necessarily need that medication moving forward. So because I think some people also, that's a fear. If I get on this medication, I'm gonna have to be on it, from here on out, or is it going to be hard to come off of it? So just listening and answering those questions is important, super important.
Yeah. And, for some people, I think too, we want to always understand the severity of symptoms. So if we're not at a, what we call severe state, we can try therapy. We can try some of the less, invasive ways of helping people. Those things have shown just as much efficacy as some of the medications do. And like I said, in an ideal world, you're kind of trying all the things because they all help in different ways. But we know that once things become, especially like you start getting the physical symptoms of anxiety, the medication does tend to be a really helpful piece. I think it puts people in a better place to receive things like therapy and be able to enjoy what the support groups can provide.
Definitely. And I think too, even like you said, just stressing the imaging piece, that is something that is very heavily talked about, whether it's the waiting period of what the scan may show, or like you said, if you have claustrophobia, where just being in a confined space and then already having the uncertainty of what's ahead can be just very overwhelming and cause you to feel anxious. And so I'm glad that you all touched on other ways far as therapeutic management outside of medication, because like you said, each individual has their own share of experiences and may cope differently with life-changing events. And I think it's important to know that what may help one person may not be identical to the next person. So I think that was very good for you all to share. And that actually leads me to my next question in reference to what treatment options are available for managing anxiety and fear, which you had discussed, but how do psychiatric medications interact with cancer treatments?
Yeah, so we know that all across the board, most of the chemo and radiation treatments have lots of side effects that can involve mood, can involve energy. Some of them even have side effects that can make you confused or disoriented. And so we just really don't know what that will look like for each person. Um, Outside of that, we also know that some of our psychiatric medications can interact with cancer treatments. So it's hard to know how each person will respond. For us, a lot of things are what we call like a risk benefit. So does the risk outweigh or does the benefit outweigh the risk of starting a medication? And usually by the time we're making a decision about a medication, usually it does, right? It's usually that the person is at a place where they, really do need that extra support. And so it's worth trying. We kind of put this out there because obviously you want to know the potential risks. But these are all things that we take into consideration when starting treatment. So any provider that is going to be prescribing these medications is definitely aware. The best things that we always tell patients, and I mentioned this like in the later slides, is always providing your whoever your prescriber is with as much information as possible. So any side effects that you notice, anytime you notice any changes, there is no way for us to know that unless you share that with us. So really just kind of being aware of your own body and what's going on, what you've noticed, what changes have happened, since you started a medication is really helpful for us.
So this slide is pretty much talking about concerns of patients with specific cancer types. So I will let you ladies review that.
Yeah, so one thing, looking into this topic today is that, each set of different cancer diagnosis comes with its own issues. And so this is just kind of a brief table kind of discussing some of the specifics. I think, goodbye, yeah. That just for people to consider that are specific to each cancer type, so with prostate cancer and, that's, that's got its own specific things around, sexual function and dysfunction, breast cancer, menopausal symptoms that come with, decreases in hormone levels. Another thing that we don't talk about a lot, but because some of these cancers are genetically linked, a lot of times this brings up fears about other family members. If I have breast cancer, does that mean my child, my daughter's going to have breast cancer, or other people close to my family? Issues around body image, if you end up with a colostomy bag, or if you end up with incontinence issues, the physical limitations that come with other cancers, not being able to live your normal day-to-day life. Any kind of reconstruction or anything that changes your appearance is obviously going to have a huge impact. And I think, because of all these kind of specific things, it does make it really helpful to be able to join groups that are specific to your type of cancer, because those struggles tend to be really individual to that group. And so, what I've noticed in those groups is that they do share a lot of things that are really specific to what's going on with you.
And that's a good point. When you say, far as speaking in reference to that particular cancer group or those side effects tailored to that particular diagnosis. And I think, of course, being aware of support groups, for example, like our neighborhood cancer connections here in Greenville that offers breast cancer support groups as well as grief support groups. Because, of course, I think when you have a group that can share experiences and have common things to say, far as this occurred with me, or having someone who can relate to those same experiences, not only can sometimes be reassuring, but just to let you know that that is a part of the process that could come about, with the experience, whatever cancer diagnosis that may be. So I think that is very informative. And also, too, far as the genetic piece, far as you said, like if a loved one, if your mother has breast cancer, and then the fear of, will I then have breast cancer? Or do I need to be proactive and get genetic testing? And so I think that's a good point to make. Just sometimes that may be overlooked, even though you might not be the direct person who is undergoing that diagnosis, but just being, in close proximity with someone who is. So this is talking about important considerations in treatment.
Yeah, so just kind of, to wrap things up on my side of it, is other things to consider is, we talked about this earlier, but making sure that you're communicating with your care team. And so when it comes to things like mental health, unfortunately, there is no test. There's no way for us to know when you're coming in that you're suffering from depression or you're suffering from anxiety or things are really taking a toll on your mental health. So the best thing that as a patient, you can do is share that with us. Because there are a lot of tools and treatment options like we discussed. The only way to get access to that is by sharing those symptoms. Um, and the hope is that, maybe by listening to something like this, that, you become aware of, oh, wow, that, this is really affecting me, or this is really affecting my family member. And there are things out there that we can do to help. So getting involved, with a provider, a therapist, like I said, anytime that you're able to kind of join the two, it's the best case scenario. Keeping a list of those side effects like we talked about, and not hesitating to advocate for your own emotional well-being, because that is such a huge, and at least from our perspective, the most important part. If you're not handling things well, if you're not being able to manage your day-to-day life well, then it becomes such a challenge then to really go into treatment and be successful long term. The As far as a coping plan, we want to make sure that that's personalized to what's going on with that specific patient. So that's why there's no you know like direct way of, like, we know that if you get this medicine and this treatment, then that's it. And that's kind of the challenge that we face in mental health is there is no one size fits all. And so we want to make sure that, whether it's depression or anxiety or both, or claustrophobia or whatever the challenges you have, that we're meeting you kind of where you're at. And then doing all the things that we always tell people, right? Getting sleep, eating well, spending time with family, doing things that are going to reduce stress for you daily. That's always helpful. Building that self-care routine that looks different for everyone. Making sure that we're regularly following with a mental health provider. And then being realistic about our expectations. Your new normal may not look like what it did a year ago. And so kind of understanding that. And I think, you know, once patients get out of treatment, another piece of that anxiety is living in that remission stage. When, if cancer does come back, will it come back? Will I always stay healthy or not? So there's always kind of that underlying anxiety that can happen, afterwards. So just being aware, and knowing that there are services out there to help.
And Laura, how important would you say it is from an integrative approach, far as in communication when you have multiple specialties involved? And for instance, if you're working with a patient who is newly diagnosed, and if you are prescribing some type of medication, how important is it to have that communication amongst providers as a whole, and then also the patient, informing and communicating with different providers? Because we touched on this a little bit earlier, but as you can imagine, it can already be overwhelming if you have multiple appointments, if you're already taking, multiple medications, and then adding on maybe a new medication and a new provider. Is that communication there? Do you find it common where you're able to staff certain concerns with the oncologist, or is it pretty much the patient kind of following up with you, letting you know this works, or if there's any changes, or do you feel like it's a collaboration amongst the two?
I mean, I think in luckily in this day and age, we do have a lot of access to, different electronic medical records, um, but it is always helpful when patients are kind of staying on top of, what's going on, at least from a medication standpoint, I will say. It is always helpful for patients to say, hey, I was just prescribed this, and, kind of bring you a good list so that, we're always aware of what's going on. We try to, do that as much as we can, but there's obviously always limitations. Always want to make sure that we're at least having the most up-to-date list of medications or treatment. But I think on the mental health side of things, it's always helpful when we know, you know, when are their chemo treatments? When are things getting worse for them? Because that also helps us gauge like, okay, it seems like anxiety is worse the week leading up to the treatment. It seems like like there's a reason behind some of this stuff.
Mm-hmm.
So more information I would say is better. And always kind of keeping all parties involved. For some people that may mean that, that they're just touching base with their oncology team, and that's okay. If they can share that and then their oncology team, feels comfortable kind of helping them manage that because some patients are not able to get out to see multiple providers at once. I would say another really great benefit about, where we're at now in medical care is that there's a lot of telehealth services. So that really provides people the opportunity to see therapists, to see psychiatrists, to see, all different kinds of providers and not having to leave their own home. So collaboration is always important, but in some ways it does fall back a little bit on the patient to say, hey, I'm seeing this other provider and I need you to know my medications have changed or this has changed or, whatever the case may be.
Definitely. So Stacy has a good case study example that we are going to discuss. And Stacy, I will let you review that.
Okay. This is actually my mother. And so that makes it very close and personal. She was diagnosed last year with leukemia. So this kind of gives you a brief overview. 77-year-old female, very active, lives alone, very independent, retired, widowed, no true formal psychiatric diagnosis in her history, some history of, trauma, loss in her past. Never really had to be on any type of mental health medications or anything like that. March of 2024, had been sick for a couple of weeks. Ended up with a syncopal episode that brought her to the emergency room. And that's when she was diagnosed with leukemia and then some infection processes on top of that. So as you can imagine, this was a complete shock to her as well as, her daughters, myself and my sister. Because we, just assumed she was sick, cold, didn't know really what was going on. So she was admitted to the hospital. So I would say for her, on first admission, of course, she was very ill, very sick. So her even processing a cancer diagnosis was hard for her the first couple of days. When she cleared a little bit and was able to kind of process that information, it was extremely shocking, very scary to her, because initially they still didn't really know exactly what they were looking at. We had to wait on some testing to come back. So that kind of fear of unknown was really hard for her. And then once we knew what was going on, then other fears, of course, set in. First and foremost, am I going to die? That was her first fear. Then, okay, then what does treatments look like? And what are my, chances with treatment or without treatment? So a lot of just unknowns those I would say, first week of hospitalization. Over the course, she was hospitalized until May. So from March to May, so had an extended hospitalization. So as you can imagine, during that time, it was just a huge transition. She was very debilitated, very weak, unable to even take 2 steps by herself, and was, of course, very active and independent. So this was very hard for her, a blow. And then that cascaded into another fear. How am I going to be independent anymore? Am I even going to, make it out of the hospital? How I'm going to live on my own, how I'm going to do anything for myself. So then, getting on top of that, just a hospitalization in itself is so strenuous, on the system. Mentally, you've got a ton of providers coming in, just pouring information to you constantly. You've got people coming in for lab draws constantly. You've got, this test, that test, so a lot of anxiety, leading to a lot of low mood, crying, depression. So the decision was made during her hospitalization to start an antidepressant. So Zoloft was one of the ones that was chosen. Works well with cancer patients typically. More, it's a calming antidepressant, so really helps kind of help manage some of that, cascading fear and anxiety. And she was also started on Remeron, which is also an antidepressant that is used a lot in cancer patients as well, because it can not only help with mood, but help with appetite, which is a problem as well, and that she struggled with. So she did well on both of those medications, and actually as her appetite improved, we were able to stop the Remeron. Then she was maintained on the Zoloft for a while, post discharge. She did stop the Zoloft. That was tapered off and stopped at a point when things were a little more manageable. But I will say a few things around that. Like I said earlier, antidepressants don't have to be long term, but we always want, and as in my mother's case, we always want to be aware that just because they get out of the hospital, just because they, are back home and maybe, a somewhat independent, living on their own, or back to what, a somewhat lifestyle that they had before, doesn't mean that they're not still struggling, especially in cases to where there's still ongoing treatments. So we need to be aware of that. And if there is a need to return back to an antidepressant, that's okay too. So just as Laura touched on, the communication is so super important for families to communicate with the loved ones, and for loved ones to communicate openly with family or friends or their providers, that, hey, I was doing okay, but now I'm struggling again, for different reasons. And now that she's home, some of that is, being a little more isolated. She's not able to get out. Fatigue plays a part, as Laura touched on earlier. Fatigue plays a big part. So she does have that new normal where her lifestyle is not as it was. She can't go and do as frequently as she used to, or when she wants to. She really has to, take it day by day on how she feels. So can be somewhat isolating for her. And still, not anxiety, but more just lower mood related to that. This is an ongoing, treatment with her type of cancer, with leukemia. It's ongoing monthly treatments. And so that can wear on you physically and mentally. So we have to keep a check on that too. and in times when the treatments affect her more physically, we see her mood really affected, at times to the point where it's, you know, she starts questioning, quality of life and things like that. So we have to make sure that we're staying on top of where she's at in that moment in time and how we can support her and assist her the most. She does, there is struggle with a lot of patients, and in her case as well, where, she doesn't want to see multiple providers, the whole oncology process, they're so super supportive and have been wonderful, but it's overwhelming, especially when there's consistent ongoing treatments and lab draws and, talking to different, infusion center and providers. So we want to, some people are very open to seeing different providers, especially, psychiatrists and therapists. Some are not. So we want to be aware of how we can best support those patients where they're at. And if they feel better, maintaining a smaller group of providers, and that's the best help for them, then that's the route we need to go. But otherwise, she is doing well. But it's a day to day. It's a day to day. Making sure that we're consistently being in tune to and communicating with her about how she's feeling, where she's at with her mood and anxiety, and how we can best serve her. And as Laura touched on, if she's not comfortable going into an office, especially like her primary provider, we're fortunate now that we have telehealth virtual visits to where she can be in her home and not have to add that to her list of office visits, that she can do that from her home. So that's super important.
And Stacey, I want to go back to when you were discussing as far as like at the time of initial diagnosis. And I know, of course, taking into account your mother having an extended hospitalization and then, of course, kind of being out of it earlier on when she was alert and aware of the situation and then finding out her initial diagnosis. Did you instantly see changes as far as in her mood, having that fear and anxiety, or over time as more workup began to come about? Would you say you noticed it?
Yeah, and I think it came in different forms. More fear of unknown initially, of course. And then it transitioned into just more anxiety about the day-to-day situation. And then we could see it even transition into frustration, and then sometimes a little bit of anger and agitation, which was out of her normal behavior. Um, uh, tired of being in the hospital, tired of having to see, multiple people in a day, tired of getting labs done every single day, tired of not having an appetite or being able to eat, tired of side effects, tired of, so you have to, as I would say, as patients, as family members, understand that there's going to be those different stages, especially in extended hospitalizations, and as they work their way through the cancer process and the cancer treatments, and just be open to even what maybe we were helping her with initially may not be what she needs later. Start again, like starting off with Zoloft to help her, and then maybe we need needed to add the Remeron on to help, with her loss of appetite and also with a little more mood boosting. So just being aware that you're not going to see a single thing. You're going to see, uh, things coming out mentally, but also just like Laura touched on, physical symptoms that we need to be aware of.
I think, one thing Stacey pointed out is, and a lot of times patients, especially some of our patients that like older populations, they have a hard time identifying the word like anxiety, right? Because that sounds almost like a mental health diagnosis. And so a lot of times that comes out in I'm worried about this, or I remember during that time, she was so worried about her daughters having to come all the time and how that was affecting their family, and worried about, how that was taking a toll on everybody else. And even just, at times not even wanting a lot of people around her, which was, very unlike her. So being able to pick up on those things and see those things, and noticing where, it is having an impact on her. It wasn't just the initial worry, but now it was sort of really, making things difficult for her, longer term, because we at one point didn't know how long she was going to be in the hospital and what that was going to look like post-hospitalization. I do think that once she started medication, it did really help with boosting her mood and also just giving her a little bit of even just maybe an opportunity to start really working on some of the things like, getting back up, walking, finding a little bit more energy, for her day to day. Because one thing about anxiety and depression, things like that, is that it makes those things that we take for granted every day really difficult, right? And we can't work on the physical stuff if we're not addressing the mental stuff.
And I would say too, just touching back on, post hospitalization, or once we get into a more of a stable scenario where patients are doing outpatient cancer center, just again to be aware of how their mental state is. And case in point, my mother, fear of asking when she knows that her anxiety is getting out of control or her mood is starting to lower. And she even said, I don't want to ask because I don't want them to think that I'm crazy. That's why I'm asking for medication. So we have to keep those conversations open of again validating these emotions as true emotions, that expected emotions, but also if it's getting to the point to where it's impairing her ability to get out of her house when she feels like physically she can, or to do some things that give her a good quality of life. If those are being impaired because mentally things are getting out of control again, we really need to be aware of that so that we can help in whatever that looks like for her, whatever she, medications, therapy, further support. So not just the initial diagnosis, not just the hospitalization, but post-hospitalization and moving forward is super important.
Definitely. And you touched on one more thing that I wanted to highlight in reference to the fear of dying. I hear a lot of patients, especially when you just hear the word cancer alone, or whether it's curative or non-curative, just the unknown of how this disease is going to respond to therapy, or what is the initial staging. And I think even that thought alone in various age groups is something that's very common. And I think sometimes we get alarmed if we hear that, but in the same token, when you don't know, again, anxiety, anxious, the unknowing of not what may present ahead, I think it can just be very overwhelming to even say, oh my gosh, is this going to take my life? Is this going to be, less severe if I do treatment? And so I'm glad that you pointed that out because that is oftentimes a common thought, very much so.
Oh, absolutely, absolutely. And I think in those times, because, and with initial cancer diagnosis, you know, we don't know.
Yeah.
We don't know what outcomes will be. We don't know depending on the type of cancer, the stage of cancer, of course, treatments are wonderful and getting better and better, and we have such a wonderful oncology group to support them. But so I think a lot of those times, initially, the biggest thing we can do is support and listen, validate those fears. And then as things move forward and you understand and the patient understands more of treatment plans, what we're looking at, then more from there, okay, now
Mhm.
how can we support you in other ways? Do we need to look at, further, medications, therapy, other treatments to kind of help you manage what you're going through,
Mhm.
just very difficult for patients and families. I would say families need
Mhm.
need support as well during that time.
If there was one thing that you all both feel as providers is essential to keep in mind in general, of course, in specific to oncology patients, but what is one thing as a provider do you feel like you should keep in mind, whether it's experiencing anxiety and fear, whether it's as a caregiver watching a loved one, what is something that you would strongly or some form of encouragement that you would give them?
I mean, I would say that, none of us are immune to mental health, that, at any given time in our lives, we will probably know somebody or hear of somebody or experience, a severe illness, likely
Mhm.
cancer. It's hard to meet anybody that hasn't been affected by cancer.
Mhm.
And I think understanding that anxiety is something very common, but also that there are ways to help, that it is not something that you have to live through without feeling supportive. Um, I think that sometimes because we normalize it, it's a little bit like, well, it's just part of what I have to deal with. But there are ways to help. And when things get really severe, they can be really impairing. And that's not I guess our goal is to make things um, as best as we can in such a tough time.
Mhm.
But I just hope that people know that there are tools out there, and that we are here to help. And there are tons of resources in the community. There's some links there in the PowerPoint presentation, but there's also a lot of providers that are out there to help. And at the oncology office as well. I'm sure that's definitely one of those things that we're always looking out for. Where are people's minds at? And that's, part of kind of our holistic approach to things.
Anything you would like to add, Stacy, before we come in closing?
Um, no, I would just back absolutely what Laura just stated, and I would just say that one of the biggest things I like to advocate for is not only patient support, which is first and foremost super important when someone is going through that, but caregiver support as well, um, because you can't be an effective caregiver for an oncology patient unless you're also taking care of yourself. And caregiver support, seeing a loved one hurt, seeing a loved one sick, seeing a loved one, and you as well having the fear of unknown, can be very debilitating for caregivers as well. So I would just encourage uh, patients and families, or patients and loved ones and friends, to kind of walk that walk together, and just open communication about how you're feeling, what your needs are, what type of support you need in those moments, and that those can change. Those can change over time. You may need a lot of support in 1 minute and may not want a lot of people around or support in the next minute. So just know that things can change, and know that with every stage of that, that there's help out there.
And I want to say thank you to both of you for sharing your knowledge as well as your expertise of doing this type of work day in and day out. Again, y'all are greatly appreciated and it doesn't go unnoticed. Um, as Laura mentioned, here are some lovely resources here far as if you were just looking for some form of engagement, whether it's mind body exercises, support groups. I wouldn't be a board member if I did not inform you that the Cancer Survivors Park has a ton of programs that not only can be educational, but as well as to help you to not feel alone and to know that there are others rooting for you, supporting you, and here to normalize some of the emotions and feelings that you may be experiencing having a cancer diagnosis, or even as Stacy mentioned, far as being a caregiver or just being a professional and working in this population. And so we want to thank everyone for joining us for this month's prevention and wellness topic. I hope that you have gained a lot of knowledge and know that you are supported. And please visit our Cancer Survivors Park. Thank you and have a
Thank
good night.
you.